Hello everyone. Today we are going to learn about the normal cells which are seen on the peripheral blood smear, that is the PS, which is stained with the Leishman stain. So on the peripheral blood smear we can see a red blood cell, that is RBCs, and white blood cells, that is WBCs. So RBCs these RBCs these are the RBCs. These RBCs, they are non-nucleated cells and they are having a central pala like this. And for comparing the size of the RBC, we compare the size of the RBC with the nucleus of the lymphocyte. If these RBCs are smaller as compared to the nucleus of the lymphocyte, they are called microcytic, and if they are larger, they are called as macrocytic. And depending on the concentration of hemoglobin inside the red blood cell, they are if the concentration is normal, they are called normochromic, and if it is less than normal, they are called hypochromic. Okay, so we can see microcytic hypochromic RBCs in iron deficiency anemia, and macrocytic normochromic RBCs in vitamin B12, that is megaloblastic anemia. Okay, so this is about the red blood cells. Now we'll see the WBCs, that is white blood cells. So this is neutrophil. This neutrophil is having this multi-lobed nucleus, and the cytoplasm is granular, which consists of pink to purple colored small granules are seen, and these neutrophils, they are the first line of defense for the infection. This is the immature neutrophil, that is the band form of the neutrophil is seen in this diagram. Then the second cell is lymphocyte. This lymphocyte is having nucleus size is larger as compared to the concentration of the cytoplasm. There is only a rim of the cytoplasm is seen in the lymphocytes. Then the third cell is this eosinophil. This eosinophil is having a spectacular bilobed nucleus, like a spectacle. Its shape is there, bilobed nucleus, and this cytoplasm consists of the granules which are coarse, bright red colored granules are there, and these eosinophils, they play important role in case of allergy, um, urticaria, or in asthma they are increased, and in parasitic infections this eosinophils, their count is raised. Then the next cell is this monocyte. This is the largest cell which we can see on the peripheral smear. They are having this kidney shaped nucleus, and the cytoplasm is abundant, and in case of infection it may show vacuolated cytoplasm. So this is a monocyte. Then the next cell, the last one, is this basophil. These basophils, they are nucleated, but they are having a coarse bluish colored granules which obscure the nucleus, and these are rarely seen on normal peripheral smear. Their count is 0 to 1% only. So the that's all about this cells of the peripheral, which we can see on the peripheral smear. One more cell we can see on the peripheral smear is the platelets. So these are platelets. These small dot like structures on the peripheral smear, they are the platelets. So these are the platelets. This is the platelet. This is platelets. Small dot like structures which are unnucleated are platelets. They play important role in process of coagulation to form the primary platelet plug formation. Okay, so along with RBCs, WBCs, we can also see platelets on the peripheral smear. So that's all about the cells which we can normally identify on the peripheral blood smear. Thank you.